Did you know that colorectal cancer is now the leading cause of cancer-related deaths in men under 50, and the rates are rising alarmingly fast? In 2024 alone, an estimated 152,810 new cases was diagnosed in the U.S., with 53,010 lives expected to be lost. Yet, this disease is one of the most treatable when caught early. In this video, we'll uncover the warning signs you should never ignore, especially if you're under 50. We'll also explore why awareness and timely screening are crucial for your health, and how you can take action to protect yourself and your loved ones. Don't wait until it's too late. Join us as we break down the symptoms that could save your life. You can identify rectal cancer by observing symptoms and signs of the disease and undergoing screening tests administered by a doctor. So, what exactly is colorectal cancer? It refers to cancer affecting the large intestine and/or rectum. If you examine the gastrointestinal system, you'll notice the intestine. The small intestine is represented in blue, while the large intestine, shown in yellow, consists of various sections including the ascending colon, transverse colon, descending colon, sigmoid colon, and finally the rectum. Therefore, any segment of the large intestine and rectum can be affected by this cancer. What are the factors that increase the risk of colon cancer? There are several factors to consider, but the most significant is advancing age. The likelihood of developing colon cancer rises with age. Other risk factors include a history of inflammatory bowel diseases like Crohn's disease and ulcerative colitis, as well as a family history of colorectal cancer or polyps. About 5% of cases are linked to genetic factors such as familial adenomatous polyposis and Lynch syndrome. Certain lifestyle choices may also heighten the risk of colorectal cancer, such as a diet low in fiber and high in fat, inadequate consumption of fruits and vegetables, lack of regular physical activity, as well as alcohol and tobacco use. Although it's impossible to predict the development of colon cancer, there are early symptoms that could signal an issue. The signs discussed in this video can range from subtle to more pronounced. Before we continue, don't forget to subscribe and click the notification bell to join us at Savgad, where we prioritize well-being. With that clarified, let's delve into the early indicators of colon cancer. 1. Alterations in bowel patterns. Colon cancer typically affects individuals around the age of 60 on average. While half of those diagnosed are over 65 years old, it can also occur in younger individuals. Changes in bowel habits are frequently an initial indicator of colon cancer. A normal, healthy colon typically results in regular bowel movements every day or every other day. Stools should be soft, brown, and easy to pass without any blood. If you observe any shifts in frequency or consistency, such as harder stools that are difficult to pass, it could indicate a matter worth investigating. 2. Diarrhea. Diarrhea, or loose bowel movements, is a frequent issue among individuals with colon cancer. The term diarrhea technically describes the passage of 3 or more unformed stools within a 24-hour period. Diarrhea can be a symptom associated with colon cancer, but may also arise from other conditions such as irritable bowel syndrome, lactose intolerance, or inflammatory bowel disease. According to the National Cancer Institute, some individuals might experience diarrhea due to bacterial or parasitic infections in their colons. Number 3. Constipation. As we know, the colon plays a crucial role in waste removal, and also in absorbing water and nutrients from our diet. This can sometimes result in difficulties in normal bowel movements for the patient. This leads to constipation, which can be uncomfortable and awkward. Initially, constipation might not appear significant, but it can serve as an early indicator of colon cancer. In fact, a study found that over 80% of patients diagnosed with colon cancer had experienced constipation before being diagnosed. Constipation can arise from various factors such as medication side effects and insufficient physical activity. At times, distinguishing between ordinary constipation and a more serious condition like colon cancer can be challenging. If you're dealing with constipation lasting more than 3 days, it's advisable to consult your doctor, especially if you also notice other symptoms like bloody stools or abdominal pain. Enjoying the video so far? Before we proceed to the next symptom, remember to click the like button and subscribe to our channel to stay updated on our informative videos. 4. Blood in your stool. Colon cancer is among the most manageable cancers. When caught early, colon cancer boasts a 5-year survival rate of 95%. Regrettably, 1 out of every 20 Americans will confront colon cancer at some point in their lives. Early detection significantly improves survival chances. Blood in your stool can indicate an early stage of colon cancer. The colon, which stores stool before elimination, is part of the digestive system where this symptom can appear. Bloody stools may also result from various cancers and conditions like ulcerative colitis, diverticulitis, and hemorrhoids. Blood in the stool typically stems from inflammation or injury within the large intestine. It can also result from bleeding in other segments of the digestive tract, such as stomach ulcers. Certain medications like antibiotics, e.g. ciprofloxacin, antidiarrheal drugs, e.g. lactulose, or iron supplements can also cause bloody stools. 5. Bleeding from the rectum could indicate colon cancer. The rectum, a 5-inch long section at the end of the large intestine, is where waste exits the body. However, rectal bleeding is quite common, and most individuals experiencing this symptom do not have colon cancer. Other conditions such as hemorrhoids and anal fissures can also cause bleeding in this area. Rectal bleeding might also stem from a polyp or another growth on the colon surface. Next up at 6, unexplained bloating or abdominal pain is another potential indicator. Factors like genetics and lifestyle choices, including diet and exercise habits, can elevate the risk of colon cancer by as much as 30%. Genetics contribute to 10% to 15% of colon cancer cases, with other factors like unhealthy diet, obesity, smoking, and alcohol use adding a 5% to 10% increased risk. Bloating is among the most frequent symptoms associated with colon cancer. Bloating can manifest in the early phases of cancer or as a symptom unrelated to cancer. It's characterized by a sensation of fullness or abdominal swelling often caused by gas. It can also be triggered by specific foods or medications. If you feel bloated after eating, consider having smaller meals more frequently throughout the day instead of 3 large meals daily. This approach can prevent bloating from overeating and help regulate blood sugar levels. 7. Persistent fatigue. The symptoms of colon cancer typically progress gradually without clear warning signs. Feeling constantly tired is common and can result from various factors, such as staying up late or not getting sufficient sleep. However, if you notice increased fatigue that persists even after a good night's sleep, it might indicate an underlying issue with your body. The colon plays a crucial role in eliminating waste from the body through stool. When this function is hindered or slowed, it can result in a buildup of toxins in the digestive system. Persistent occurrence of this can contribute to the development of cancerous growths in the colon wall. If you frequently feel tired and experience other symptoms like bloating or abdominal pain, these could be early indications of colon cancer. 8. Unexpected weight loss. Symptoms of colon cancer differ based on the tumor's location and stage of development. Unexplained weight loss can indicate early stages of colon cancer or other gastrointestinal disorders. However, there could be other explanations. For instance, it's typical for older adults to lose weight after recovering from an illness. If you've lost more than 10 or 15 pounds over a few months, it could potentially signal colon cancer. 9. Persistent feeling of fullness. While a nutritious diet can reduce your chances of developing colon cancer, it may not be sufficient on its own. Exercise plays a crucial role in prevention as well. If you constantly feel full, even without eating, it could indicate a digestive tract issue. Colon cancer can lead to bloating, constipation, diarrhea, and other digestive problems that can interfere with normal eating patterns. Initially, these symptoms are often mild and easier to overlook or dismiss compared to other signs of colon cancer. In fact, if you experience additional symptoms such as weight loss or fatigue, you might attribute your issues to something else entirely and delay seeking treatment. Whether you're 61 years old or 16, the most effective approach to prevent the disease is to consume nutritious foods, stay active, and maintain a healthy weight. Doing this will help maintain the health of your colon. If you have a first-degree relative, a parent, child, or sibling, who was diagnosed with colorectal cancer before the age of 50, your own risk of developing it is higher than average during your lifetime. If 2 immediate family members have been diagnosed with colorectal cancer before age 50, your risk is higher than average. African Americans face the highest risk of developing colon cancer compared to other racial and ethnic groups in the United States. While this disparity may stem partly from variations in access to screening tests rather than solely biology, it's crucial to remember: if you experience any of the symptoms mentioned earlier, don't hesitate to reach out to your doctor. Keep in mind that these could be early indicators of colon cancer rather than conclusive symptoms. And if you possess any of the colon cancer risk factors mentioned earlier, it's important to consult your doctor about whether colonoscopies are the best screening option for you. Did you find this video helpful? Please hit the like button and subscribe to our channel for additional informative videos. Thank you for watching. Your well-being is our priority.